we study the three pelvic organs: the urinary bladder, uterus, and rectum anal canal. So by this Saturday, I will be done for those who are attending, and those जे कामगार दिनानिमित्त महाराष्ट्र दिनाचे सेलिब्रेशन करायला महाराष्ट्रात आपल्या गावी गेले, आय कॅनॉट हेल्प देम. आत्तापासून जस्ट फ्राइडे को छुट्टी आया तो आप मंडे से गायब हो जाते. एक लिमिट होता है यार लॉन्ग वीकेंड का. अब वीक ही ले लेते हो पूरा. Like the respiratory system develops as an extension from the foregut, most of the parts of the urogenital system develop from the hindgut. So, it's okay. This is the terminal portion of the hindgut, which is called as cloaca. Now, cloaca is there in lower animals, where there is a single opening for passage of urine and stool. In development, the lowest part of the hindgut is called cloaca, which is closed by cloacal membrane. This cloaca is attached to the umbilicus by allantois. Now what happens is, a septum develops over here called as urorectal septum. Urorectal septum. Today in the, I think Dr. Kavita is going to take lecture on midgut and hindgut. So please attend it. Okay? Because midgut rotation very difficult to understand, and this also what I am teaching, so it will be kind of become firm in your memory. Now this point where it actually meets, that's where the perineal body is formed. So now it is divided into a posterior portion called as rectum. Right now we are not concerned with this, and anterior portion called as primitive UGS, the primitive urogenital sinus. Primitive urogenital sinus. Here is the opening of the mesonephric ducts, and point where the mesonephric ducts open on both the sides. The part below that is called definitive urogenital sinus. And part above that is called as vesico-urethral canal. So this is vesico-urethral canal, and this is definitive urogenital sinus. Okay? Developing from vesico-urethral canal is urinary bladder and prostatic urethra. Urinary bladder and prostatic urethra, and in case of females, the urethra. developing from definitive urogenital sinus is the pelvic and phallic urethra. The spongy urethra, pelvic and phallic urethra, which is the spongy urethra. Spongy urethra. Now understand what happens. This is the developing bladder. Here are the openings of the two ejaculatory ducts. So this part is vesicourethral canal. Okay, and below down. Now you are looking from the front. आप आगे से देख रहे हो. यहाँ से allantois होगा. That allantois will obliterate and form median umbilical ligament. And this is the definitive UGS. So this is front view. This is vesicourethral canal and this is definitive urogenital sinus. Now what happens next? From this mesonephric ducts which we are talking, the urethral buds arise. Urethral buds arise and they go into metanephros. They go into the metanephros, right? And that's how kidney develops. The kidney will also increase in size. In the next step, what happens is this portion gets absorbed. So now in the vesicourethral canal, there will be 1, 2 openings of the mesonephric duct, 3, 4 openings of the ureters, because this portion will get absorbed and now ureters will open separately. Now as the kidneys ascend, these openings of the ejaculatory duct remain here only, ureteric openings go here, and this part, posterior portion, is called as trigone. Welcome. Called as trigone. Trigone of the bladder. The endoderm of the bladder develops from hindgut. Hindgut is endoderm. So epithelium of the bladder, most of the epithelium of the bladder is from endoderm, from hindgut. Well, the epithelium in the trigone area, numera, epithelium in the trigone area will be from which germ layer? Brunali? Trigone. Mesoderm. Because these are all developing from intermediate mesoderm, right? The mesonephric duct, paramesonephric duct. We had drawn mesonephric, intermediate mesoderm enlarges to form nephrogenic cord where there are metanephric tubules, paramesonephric duct, mesonephric duct, and genital ridge. So this trigone, this part is from mesoderm, remaining part of the bladder epithelium is from endoderm. So these ducts, they go up, yeah, and this is the development of urinary bladder. Of course, the detrusor muscle develops from splanchnopleuric mesoderm. त्याचं मागचं हे व्यवस्थित उभं मागचं हे इथून सुरू करा. So we are talking about development of the urinary bladder. It develops from the hindgut. Hindgut initially is called cloaca. This cloaca is divided by urorectal septum into rectum and definitive urogenital sinus. At the point of opening of mesonephric duct, primitive urogenital sinus. This primitive urogenital sinus now divides into lower definitive urogenital sinus from which spongy and part of the urethra develops, and upper part vesico-urethral canal from which urinary bladder develops. Now you are looking at the front view. This is vesico-urethral canal. This is definitive urogenital sinus. These are the openings of the mesonephric duct which are giving ureteric bud which are going into metanephros. Now this part of the mesonephric duct get absorbed. So now mesonephric ducts are opening and ureters will also open here. So you can see that. As kidneys ascend, the ureters also ascend up, and this part of the bladder on the posterior wall between the two ureteric openings, and below here are the two mesonephric ducts which are now forming ejaculatory duct. Of course the bladder is only up to here, so this part is in the prostate actually in males. This part is called as trigone of the bladder. So in development of the bladder, the epithelium develops from endoderm of the hindgut from the vesico-urethral canal. The trigone epithelium develops from mesoderm. The muscle detrusor also develops from the which mesoderm? Splanchnopleuric mesoderm. Thank you. Now we are moving on to इसको जरा क्लियर एक दिन किसी को बोल के ना इसको भी झटको बाहर इसका कैपेसिटी फुल हो गया अभी, तो थोड़े दिन के बाद उसका ही रंग लगने को चालू हो जाएगा. Now talking about the anatomy of the urinary bladder. Firstly, the location. Location is in pelvis. Firstly, I would say in children and adults. In adults, it is in pelvis, most anterior. Okay? Adults, it is in the pelvis and located most anteriorly. In children, it is descending from abdomen to pelvis. Slowly, slowly. So when you talk about location of bladder, किसी ने आपको पूछा तो you can give a smart question back. In children or adults? So you can say, oh, abdomen. In children it is abdominal and going into pelvis slowly, slowly as they approach, as the age increases. You know how smart questioning can be, Shalva. And you people are more, students are more champions in asking counter questions, even in exams. Describe the kidney. Sir, human or animal? Human kidney. Sir, adult or child? Adult kidney. Sir, male or female kidney? Male kidney. Sir, normal or abnormal kidney? Normal kidney. No sir, I don't know sir. तो हम लोग भी ऐसे ग्रिल करते. और ये जो है ना, बंद केलस का नाम चालू है. हाँ, पर चालू. And these type of questions previously in MBBS courses there used to be something called as chronics, जो 10-10 साल, 15-15 साल, 20-20 साल से MBBS कर रहे, ऐसे हमारे कॉलेज में भी लोग थे. In our college, we had one boy who was GS of that college 20 years back. And when I took admission, he was still studying. So one day I saw his room open. People had told me, either. So I went to his room and said, "You are?" He said, "No, I'm his son. I'm preparing for 12th." So he had married और उसका बच्चा उस हॉस्टल के रूम में रह रहा था. और ऐसे क्रॉनिक जब एग्जाम को आते थे तो you know the whole department used to be cheering so that they pass. External, from the point external examiner used to come, people used to tell me, "Sir, इसको निकाल. External examiner said, "Okay, इसको निकाल दो." One question, uterus का specimen लिया. One question, what is this organ? Identify. Sir, I don't know. Male examiner, male student, he said, "I give you one clue. This is not there in my body. This is not there in your body." He said, "Sir, brain." Examiner said, "I'm passing you because you are 50% correct." Okay, thank you. तो वैसे ही ब्लैडर में you can start like this. Sir, child or adult? Where is the location? Adult. For adult examiner, when he says adult, you should say, "Sir, whether when bladder is full or when empty." So when empty, it is pelvic. When the bladder becomes full, it crosses the pelvic brim. So when it is full, it crosses the pelvic brim and becomes abdominal. So much abdominal that if somebody presses here, he can actually feel for the bladder. Okay? Prithviraj, बरोबर है कि नहीं? Now shape of the bladder. Again, when the examiner asks you what is the shape of the bladder, you have to ask him, "Sir, whether it is empty or when it is full." When empty, its shape is like this, tetrahedral. Okay? The shape of the bladder is like this. Yeah, such a nice, beautiful diamond-like bladder is there. All of us have. We may not have diamonds in life, but this is the apex, this is the base, this is the superior surface. There are two inferolateral surfaces. Okay? Now, they may ask, what happens when the bladder becomes full? The superior surface goes behind. So now the apex is here, this, that, and these two inferolateral surfaces. The inferolateral surfaces become anterior and the superior surface becomes posterior. And apex is on the top. So the bladder, which is like this, becomes like this. So bladder is like this, two inferolateral surfaces, one superior surface. It becomes like this. Okay? And today we are going to learn that. So Odni Laul Angi, Shreya ne Angi. Okay? तो सिंगल टिक से मेरे को समझते आप लोग कितने बजे उठते हैं. मैंने मैसेज किया था सुबह. मैं हॉस्टल के लड़के, मुझे जब ध्यान आया कि चुनरी चाहिए आज, कुछ अपने को मिलियन व्यूज वगैरह नहीं चाहिए, चुनरी चाहिए आपको समझाने के लिए. एंड इन लोग को, मैं मुंबई वालों को इतने सिंसियर है, ये लोग इन लोकल से उतर के वापस घर पे जाके चुनरी लेके आए, किधर धड़पड़े के बीच में. तो मैं हॉस्टल वालों को बोलता हूँ, सिंगल टिक सुबह 5 बजे से मैं देखता हूँ 6 बजे, 7:30 बजे, 7:45 बजे, तुम लोग क्या उठते हो और सीधा आ जाते हैं. ओके, चल. So now the next point is कैपेसिटी ऑफ द ब्लैडर. तो ब्लैडर का कैपेसिटी कितना है? कैपेसिटी ऑफ द ब्लैडर इज अगेन different मतलब not in different people, in same person.
Anatomic and physiology.
At 200 ml, a person gets the first sensation that some urine is collected in the bladder. So such person, when he is traveling by Mumbai, Pune, Volvo, he just goes to the driver like this. And he asks, sir, when is the next stop? The driver looks at him, why? No, like, nothing. जाके बैठ जाता है. ऐसा somebody behaves like this, you have to understand. 200 ml. Anybody just gets up and comes back, that means 200 ml. It's tolerable, but he has got the sensation. He is just anxious now. So 200 ml, one gets the sensation. 500 ml, he goes to the driver. He doesn't ask where is the next stop. He says stop, because it becomes painful, slightly painful, no? Not painful. Person becomes aswastha. He cannot concentrate. He cannot sit. And fortunately, they don't know what happens next, because if the driver doesn't stop, then at 1000 ml, the person sitting next to him goes to the driver and says, why didn't you stop? Because there are two things that happen. That person loses control or his bladder may burst. Okay. So such things, this is the anatomical capacity, the final maximum capacity, after which the person loses control or bladder may burst. Okay? Thank you. Now one word about each part of the bladder. एपेक्स. साहिब क्या बोलना आपको एपेक्स के बारे में? Apex is connected to the umbilicus by median umbilical ligament, which is a remnant of allantois. Anterior. This is the anterior part, this is the posterior part. This is the superior part, this is the inferior part. So this is the apex. Okay? Clear? Now, superior surface is the only surface covered by peritoneum. Only surface covered by peritoneum. Okay? So peritoneum anterior abdominal wall से ऐसे आता है, यहाँ पे it comes here like this and it dips here and then goes. So base, upper part of the base is related to the pouch. So peritoneum plus SI, small intestine, this is pouch plus SI. Small intestine में इतना बड़ा ये है कि उसको जिधर जगह मिलता है वो घुस जाता है, pouch में भी घुस जाता है. Okay? So this pouch will be this online shopping, online courier. ये इतना बड़ा anxiety है ना. I just book. We feel it's very comfortable. It comes at the doorstep. I had booked the courier and came here. उसके बाद भी सर मैं इधर हूँ, इधर कोई नहीं है, ये OTP चाहिए, नहीं तो वो डिलीवरी अटेम्प्टेड करके चले जाते, मालूम है ना. My worst period was when I stayed as warden there at KEM में. Worst period in the sense for Amazon is concerned. मैं हॉस्टल का वार्डन, ओके, और वो मुझे फ़ोन करते थे, सर मैं आपका पार्सल लेके आया, बॉयज हॉस्टल के सामने खड़ा हूँ, कहाँ पे? मैं बोला ये आप सामने देखो राइट साइड पे वार्डन्स क्वार्टर है। नहीं रूम नंबर बोलो। मैं रूम नंबर नहीं, मैं इस पूरे हॉस्टल का वार्डन हो, इंचार्ज। नहीं रूम नंबर बोल रहे, एक दो तो बोल रहे, मैं रे ऐसा कर देते, उसको बहुत मैं प्रयास करता हूँ, बोलते थे मैं लेके जा रहा हूँ वापस, जस्ट बिकॉज दैट मुझे बाद में लगा ना मैं डीन को एप्लीकेशन लिखूँ कि वार्डन्स क्वार्टर को भी एक रूम नंबर दे दो, रूम नंबर 10, बिकॉज मेरा ना ऐसे हॉस्टल के बाहर अलग से एंट्रेंस था, मेरा आधा पार्सल वापस जाता था। ओके, बेस कहाँ पे हम लोग? बेस का लोअर पार्ट। इन मेल्स इट विल बी रिलेटेड टू द सेमाइनल वेसिकल्स, इन फीमेल्स it will be related to vagina cervix, okay. So in males it will be related to seminal vesicles, in females it will be related to vagina and cervix. neck, ये पार्ट को neck बोलते हैं, inferior part, neck. In males this neck is related to prostate, because urethra वहाँ से prostate में enter करे. If you have another view of this is the urinary bladder in males, this is the urethra, this is the prostate which is surrounding. Okay, here there is sphincter urethral muscle, and then this is the penile urethra. In case of males, the urethra is 15 centimeter, penile urethra 3 centimeter is prostatic, 3 centimeter prostatic urethra, and 1 centimeter is membranous urethra. Three parts of the urethra: prostatic urethra, membranous urethra, and penile urethra. This penile urethra has a pelvic part which is there inside the pelvis, and the spongy part which is outside, which has corpus spongios or corpus cavernous. Okay, and at the end is the glans pes. The prostatic urethra is crescent shape. Membranous urethra is star shaped. Penile urethra is a horizontal slit, and at the exit point of the glans penis is a vertical slit. Because of this, the urine, when it flows through the urethra, out of the urethra, there is a slight twisted flow in case of males. It will show a twist. एक आध पेशेंट भी आपके पास आ जाएगा कि सर वो मैं यूरिन पास कर रहा था तो मैंने देखा कि ऐसा सा ट्विस्टेड फ्लो है, तो उसको फिर एक बोलेंगे तू बैठ अभी मैं तुमको बताती हूँ. उसका रीजन ऐसा है कि प्रोस्टेटिक यूरेथ्रा इज क्रिसेंट शेप, मेम्ब्रेनस यूरेथ्रा इज स्टार शेप, द स्पॉन्जी यूरेथ्रा इज अ हॉरिजॉन्टल स्लिट, and the glans penis, the exit is a vertical slit. So when it passes through so many different shapes, it becomes twisted. Okay? Lumen. I'm talking of the lumen. When I say this, see some things now people notice at very late age, and they will complain like this. Someday they may touch the urine, and they say it's hot, और वो आपके पास आएगा वो यूरिन गर्म है, मेरे को कुछ नहीं लेकिन यूरिन को टेम्परेचर, वी आर वार्म ब्लडेड. ओके, द यूरिन इज स्लाइटली ऑलवेज वार्मर. ओके, द पर्सन में कम testes you have studied, which testicle is lower? The left testicle is कॉन्फिडेंट है ना तुम्हें? तो सडनली ऐसा भी पेशेंट आ जाता है, अरे मैंने देखा लेफ्ट लोब. So these are some normal anatomical things which a person, anything about the private parts, no? A patient becomes anxious. Inferolateral surfaces. Now this whole diagram I had drawn to show you about the, now this is the pelvic wall. On the pelvic wall, अभी देखते हैं आपको याद आ रहा है क्या? Is a muscle on the inner side. What's a muscle? Obturator. And from this obturator internus arises another muscle. Levator. So inferolateral surface, ये सेक्शन में आपको नहीं दिखेगा, बट ये जो सेक्शन है ना, दिस इज अ कोरोनल सेक्शन. कोरोनल सेक्शन, इसके लिए पेल्विक वॉल्स ऐसा ऐसा दिखता है. हाँ, इंफेरोलैटरल सरफेसेस क्या है वहां पे? ऑब्चुरेटर इंटरनस एंड लेवेटर. ऑब्चुरेटर इंटरनस एंड लेवेटर. So that covers relations, that covers the anatomy. Now when the bladder becomes full, it becomes oval shape, and the inferolateral surfaces, they become anterior, and superior surface becomes posterior. Superior surface becomes posterior. ओमकार राउत आलाय कहाँ से? तू ही करेगा ना जिम्नास्टिक आज इधर? Okay. Blood supply of the bladder. You have to just remember the word vesicle. The superior vesical artery, inferior vesical artery, venous drainage is by the vesical plexus. Okay? Now the nerve supply. Nerve supply, the parasympathetic comes from S1, S2, 3, 4. What is S2, 3, 4 called as? नर्वाई एरिंजेटिस. ये नाम सुना है क्या आपने? ऑटोनॉमिक नर्वस सिस्टम सिखा है ना आपको? The parasympathetic outflow is craniosacral. Cranial comes from the cranial nerves 3, 7, 9, 10. Sacral comes from nervi eryngietis. So this supplies most of the pelvic organs. Uterus, anal canal, parasympathetic. And pain is from pudendal nerve, which also has the same group, S2, S3, S4. And sympathetics. Krishant, sympathetics क्या है? L, T11 to L. एक्चुअली हम लोग जब सिंपैथेटिक्स का बात करते हैं ना, सिंपैथेटिक का दूसरा मतलब क्या है? What is other meaning of sympathetic? Being kind. Oh, so sympathetic, is it kind? It increases your heart rate. Fever, everything, blood pressure. Is it kind? No, it is kind. It is kind when it comes to the terminal parts of the bladder and bowel, and that is the reason we can thank the sympathetic system. Here in the bladder is a sphincter, which is sphincter vesicae, which the sympathetics make it constrict, and it relaxes the detrusor. Okay, so a person is able to hold on the urine till he finds a urinal or till the bus stops. Okay, so it is sympathetic. Parasympathetic, it will open the sphincter. Okay, now what is the pudendal nerve? Here around the membranous urethra is sphincter urethrae. Sphincter urethrae is here, sphincter vesicae is here. Sphincter vesicae is under autonomic control. Bladder is full, parasympathetic will release. Sphincter urethrae is under voluntary control. Okay? In males it is below the prostate, in females it is below the bladder. Sphincter urethrae. So this sphincter which is constricted, even the external anal sphincter, the urethral sphincter, the bladder sphincter, these all are constricted by sympathetics, and the muscles around are relaxed. Muscles above are relaxed. So that is one reason you can call, remember कि वो sympathetic है, मेरे को बचपन से बहुत मदद की है उन्होंने, बचपन नहीं. Applied anatomy. Congenital anomalies. Congenital anomalies of the bladder. Ectopic vesicle. Ectopic, this vesicle को vesicle, A-E, vesicle. What is ectopic vesicle? Sometimes anterior abdominal wall fails to develop and you directly see the trigone. वो ट्राइगोन जो होता है ना, यहाँ पे होता है ऐसा ट्राइगोन, यहाँ पे ओपनिंग्स होता है यूरेटस. You directly see the trigone and urine coming out of it. ऐसे मतलब पेशेंट का जरा सा ये ऊपर किया तो सीधा यूरिन बाहर आ रहा है डायरेक्टली बॉडी पे. Anterior wall doesn't develop, this part of the bladder also doesn't develop. It dependent on that support. मैंने देखा है ये पेशेंट जे में एक्चुअली I could see the urine dribbling through the ureters. Then investigations. इन्वेस्टिगेशन में एब्डोमेन में क्या है? स्कोपी. मेडिसिन, मेडिकल, सिस्टाइटिस, cystitis is the inflammation of the bladder which may be caused by infection. This is more common in females. Again, one reason the urethra being only 3 to 4 centimeter, 3-4 centimeter वाला कितना इतना सा. In males the same urethra is 18 centimeter long. Okay, and that is one reason you must have again and again seen the moments happening amongst females and protest clean toilets on the railways or clean public toilets. That is one reason, because they are more susceptible to this. Okay, again the component of vagina and the hygiene kept around that also plays another very important role. Okay, so drinking a lot of water is one thing which can always prevent cystitis. But again, in females if you see कि वो पानी पीने का भी in general ऐसा कम ही रहता है. इधर आप लोग बड़े बड़े बॉटल लेके आए आजकल, बट पहले तो मैं ऐसा छोटा सा बॉटल में ही आते थे, इतना करके दिन में इतना सा ही पीते थे पानी. और वही गलती से किसी अपने मेल दोस्त को देते नहीं ना बॉटल आप कभी, क्योंकि वो क्या करते अभी खत्म. So males in general have a tendency to drink more water. Females का मैंने in general observation, I'm just talking about in general observation, कि water drinking is less, which they have to increase. Just as an advice from my side, कि जितना पानी आप ज़्यादा पियोगे उतना फ्लशिंग होता रहता है, continuous flushing happens of the urethra. Then इतना जल्दी नहीं पीने का, इतना कोई जरूरत नहीं है, ऐसा बीच बीच में. So that flushing keeps on happening. Okay? लोग ना पानी पीने से डरते हैं कि भाई मैं पानी पिएगा फिर बार बार बाथरूम जाएगा, फिर लोग बोलेंगे क्या रे कितनी बार जाता है. बोलने दो, because cystitis is so bad ना, you pass urine, there is pain, then you go to the urinal, you pass few drops and there is pain and a feeling that the bladder is full but nothing is passing, and then there is fever and then that infection spreads. इससे अच्छा पानी पियो, पब्लिक का गाली खाओ, क्या क्या बार बार बाथरूम में जाते हैं लोगों ने, बाथरूम में ही रहना तो इससे अच्छा. हाँ ठीक है बाबा, वार्ड में रहने से अच्छा बाथरूम में रहता है. सर्जिकल में 2 थिंग्स. तो इसमें सिस्टोस्कोपी, इसमें सिस्टेक्टॉमी भी होता है बट वो बहुत कम. Cystoscopy means ultimately they open the bladder to the external and then from there. And the last part for which I will request Charlotte to, bladder cancer. Bladder cancer, their awareness has to be spread about bladder cancer. First time they observed bladder cancer in patient working in paint factories, production of paints. So paint used to be there on their hand, they used to wash, not so, they don't wash with spirit, they used to eat food, morning, evening, go home. So that paint which is carcinogenic used to go in the system, the kidneys used to throw it out and then it goes to the bladder. Now we don't empty the bladder every half an hour, 1 hour. At least 3-4 hours. The paint is remaining there. Paint is remaining there. And that's how cancer happens. When a person is artificially consuming colorful matter, which are artificial colors. Now relate this with substances having artificial color. Now relate this with hair color. Hair color. Hair color, आपने hair color का क्या है? Every day when you take bath, every time you do like this and then eat. So there is a connection because slowly you are carrying a poisonous substance on the head. Therefore, you must have seen on hair color it is said that this is completely organic, zero chance of becoming. Why cancer? Because anything which is going from any part of your body, any color in the abdomen will be going to the kidneys, then it will be thrown away by the kidneys and into the bladder. But problem is it stays in the bladder for hours together and it gets nice chance to act on the bladder. And that is why consuming artificial colors is not advisable. Thank you. Okay? The last part, itna sab ho ke I don't want you to lose some marks because the question asked is draw the histological section where you show the fibers of detrusor which are haphazard, they are not quite organized, and then you see the epithelium. Epithelium is transitional epithelium, and then there are umbrella cells. I have spoken about umbrella cells to you before also. Umbrella cells are stretchable cells. Okay? So that's about the bladder. ते फक्त pause कर.